Made this binder, this manual we call it,
Yep.
and I want to quick go through it to show you what's all in there, and specifically I want to talk about the other insurances in Medicare. Like the first tab, well, first of all, there's a table of contents that goes through the sections and what's all in it. That's pretty self-explanatory. Then there's the first tab. It's just all about the SHIINE program if you want a more in-depth history of our program and how we report using our data systems, that kind of thing. We're gonna go into that data system later, so that's where details and copies and screenshots are, and I'll bring that up when we're going through it later. Parts A and B, I did a very, like I said, high level, just really quick overview of Medicare parts, all the parts of Medicare. That training that you do online, that goes in deep detail. And so does this. This really talks about the ins and outs of Medicare. And we group parts A and B together because there's a lot of things that could be one or the other, and it explains all of that. So I'm not digging into that right now. There's the supplements. Really puts into detail all about supplements, the open enrollment, that guaranteed issue rate, that first 6 months when you can't be medically underwritten. It goes into deep detail on that. I'm cruising. I'm just getting to this other insurance, so we're cruising along this here. Part C is those Medicare Advantage plans. This helps to explain those much better, much more thoroughly. There are a lot of different types of Medicare Advantage plans, and it goes through that. It includes the cost and why someone would choose an Advantage plan over original Medicare. It helps you, there's areas that help you weigh that out with a beneficiary. If they were having a lot of questions, you could refer to this and maybe feel a little more comfortable with it. Might help you understand it a little bit better too. Part D, same thing, goes into deep detail, goes into the rules on what the plans must cover. It goes into deep detail on the different restrictions that are out there, that why a plan may not cover a drug, or maybe some ways that a beneficiary, if they have, let's say, prior authorization, sometimes a plan will require that the doctor says that that person needs to take that medication. Or other times there's like step therapy. Maybe they need to try the lower cost meds before they can try that main brand med. So it goes into the details of those things, and it goes into detail of the cost and that donut hole, phasing that out. It also does a step by step through the Plan Finder tool on Medicare.gov. We talked about that. That's the best tool. It's a really amazing tool. You'll love it, to compare plans and help people find the lowest cost plan. It does it all for you. We teach you how to read those reports and summaries to help them understand that a little bit better. So that is a really good step-by-step guide. After I made this manual, somebody asked, it'd be nice to have a walkthrough of somebody who's new to Medicare, what they all, in a more step-by-step, I'm starting Medicare type fashion. So there is a new to Medicare tab, and that walks through just all the initial parts of each part of Medicare and how to enroll and things to consider. So that's just one we made up just because it was nice to group it all together. The next tab in this binder is appeals. It goes through the complaints and appeals. You typically, our volunteers, do not deal with that at all. I have a couple that really just love appeals and love walking people through that. And it's awesome. They know way more about it than I do. But it's really written well in this book and easy to understand. However, like I said, you would typically refer those to us. Most people do not feel comfortable, do not want to touch them, and just send them to Tom, and even even when it comes to Tom and Dusty and I's level, I would say we don't really deal with them much either, right?
Are you talking about like the first level of appeal for
Yeah.
Medicare?
You direct them to how to do it, but then.
Yeah, the first level is actually printed on their Medicare summary notice.
Yeah.
All they have to do is turn it over, write what they don't agree with, and mail it back into the location.
But do you see it much at the next levels?
Hardly ever.
Yeah, see, I don't think we really help a lot of people with that because it must either get resolved or Medicare must do a decent job or the plans must do a good job at working with those people because I don't think we see much of the next level. Section 8 or that next tab is assistance programs. That walks through that extra help, the Medicare savings programs that are out there. It also talks about the LINET program, which we will talk about later. And here we are now at the other insurance tab. See, I told you I was gonna just cruise for that. But that online training, I did not want to be super repetitive. That online training will dig deep into this. We just did a quick touch up on it already. I don't want to do another one of those. And this goes into it really well. It's just another good resource, and a lot of people just bring it with when they counsel people in case they have a question. It's broken down nice. But I find this other insurance tab very helpful myself. Page 160 and 161. Is everyone following along?
Yep.
I feel like we really good there. An important part of other insurance and Medicare is who pays first? Who's gonna take care of the claim? If you have two different types of insurance company, two different things of insurance, who's gonna take care of the bill? And Medicare does have very specific guidelines on that. Like if you were just in an auto accident and you have injuries associated with that auto accident, Medicare is gonna say that insurance company that is liable for those auto claims or any injuries associated with, they're gonna take care of those. Medicare will not. So things like that are specified and written out really clearly with Medicare. And they even have a whole division of Medicare just for the secondary care, who's responsible for what claims. And this little chart is that's the basics of if a beneficiary has Medicare and Medicaid, they're entitled to both, Medicare and Medicaid. And what Medicaid is a state-based insurance for low-income, low-resource individuals. And in all cases, Medicare pays before Medicaid pays. So the federal government insurance is gonna pay before the state government insurance pays every time. And that's just an example there. Next page, 162. And we'll walk through this a little bit here. Employer group plan. So if somebody is actively working and has health insurance and is eligible for Medicare, one of the first things, and it seems like an odd thing to start with, is how many employees are working with that employer. And you'll see in this first paragraph, it's the very last sentence, an employer with less than 20 employees pays secondary to Medicare, and if they have over 20 employees, that insurance company would pay primary to Medicare. Really odd stipulation, but that's the first thing that I ask people if we talk about employer health insurance. Also, if it's with active work, so if they're actively working, it's their health insurance benefit, they could delay Medicare coverage and not be penalized. So that is credible coverage for that person. In most cases, people will take Part A because they'll want that, or if they have over 20 employees, they'll have to have it because it would pay primary to their insurance. Or wait, their insurance would pay primary to it, but still, I had that wrong, sorry. If they have less than 20 employees, they would have to take out Part A because they would bill Medicare before that insurance company.
And just about everybody has premium-free Part A anyway.
Yeah, so usually it's free, it's $0 a month. but they're just enrolled in it. And then if they have over 20 employees, and in all cases, most people will delay taking Part B because they don't wanna pay that premium, plus they wanna delay that guaranteed issue right, that 6-month opportunity to get into a supplement plan without underwriting. So that's, a lot of people will choose to delay it. There is a little caveat, and it starts with most. Most beneficiaries elect to enroll in Part A when they are first eligible because it is usually premium free. If the beneficiary has a health savings account, that's a high deductible health plan with an opportunity to save in a very specific tax favorable account. You need to know, and there's more information in this section about health savings account, but that health savings account, they can no longer, if they have Part A even, they can't contribute into those accounts anymore. They can take money out of them and use that money in that savings account, but they can't contribute anymore because Part A is not considered a high deductible plan. So there's little rules like that. And we have this brochure, medical and employer health coverage. I do presentations for the South Dakota retirement system, and all of them are about the transition, and this is a great brochure on walking someone through that transition of employer coverage to Medicare, and which ones and it does include that health savings account information. It's just a great one to say, if someone is questioning starting Medicare, if they've delayed it especially, this is a good one to just give them, because it'll do the ins and outs and they just can read about it. You don't have to sit there and talk through it. That's a really good one for that. This next page talks about that health savings account and how you can't contribute into it without having that penalty on that particular account. Here's page 164, retiree plans. You'll see there's in each section it all looks the same, just for consistency here. It talks about retiree plans with parts A and B. It's that first 3 bullet points. If it's not tied to active work, it's not going to be credible service for parts A and B. So if it's a retiree plan and it's actually their health insurance, it's not just a Medicare supplement. Sometimes they'll word them like that. It would not be credible, so they'll need to pick up Medicare Part B and Medicare Part A. And if they don't, they'll have a penalty. And then I'll talk about with supplements. It depends on the different benefits. It gives a good explanation of what to say if someone were to ask you about this. A traditional Medicare supplement typically would offer a better, more complete coverage that works better with Medicare. And sometimes the retiree benefits can be better coverage. So it's just a good idea, as in all cases, to evaluate that and weigh the benefits of both. But typically, a retiree plan and a supplement are not needed at the same time. Typically, you would have one or the other. And then for Medicare Part D, retiree plans would be credible coverage. So typically with a retiree plan, you would not accrue a penalty for Medicare Part D. Each year, the Part D, or your plan, so your retiree plan in this case, would send you a statement or a letter saying this is credible coverage for Medicare. They have to communicate that each year, saying it is credible coverage for Medicare. So they would want to make sure that. And then there's, in most of the items in this section, there's another little box, and it kind of explains more of the caveats to that. So it goes into further the Medicare Part D with retiree coverage. The next, page 165, I'm happy to go into more detail if you guys have questions, but that's typically not one I see a lot of. So I'm gonna go hit the ones we really see a lot of most. Page 165, federal health employee benefits. Typically, they are a better benefit than
Coverage, yeah.
Medicare, especially for Part D. A lot of people will try to weigh the cost with you, and these are some good points to consider. It is not credible coverage, so they do need to pick up Part B, but it typically is credible coverage for Part D. I've never seen it otherwise anyway. And it works similar to a supplement. And I've heard really good things about federal retiree benefits, so I've never heard anything really negative in how it works together. They just need to have Medicare Part B is really the main thing that you'll get from the benefits. Page 166, COBRA. That's a little different. That's if somebody needs to terminate their employment. It's mandatory that they offer at least 18 months in most situations of continuous insurance coverage. Well, if someone is Medicare eligible, COBRA is not considered credible coverage. And so if they, it's for Part B anyway. It's not credible coverage for Part B, so if they have that, they would want to pick up Part B instead of COBRA. Most likely, when they're evaluating it, they probably won't take COBRA. They'll just start Medicare.
And in most cases, it would be way more expensive.
Oh,
Yeah.
absolutely.
Yeah, COBRA is usually not cheap. VA benefits, that's the next page, 168. With VA benefits, they do need to have Medicare Part B. They need to have that, or they're gonna have a Part B penalty. But VA benefits are considered credible for Part D. So they do not need to pick up a Part D plan unless they want to. And a lot of times people do. Same thing with a Medicare supplement. They could wait and enroll in a supplement later, but as we all probably know by now, we've said it enough times, they may have troubles getting into a supplement plan because they can underwrite that individual and it can be very difficult. Page 170, TRICARE for Life. TRICARE for Life is very comprehensive. They actually mandate that that individual who qualifies for TRICARE. Well, I should specify this. Let me see here. Yeah. TRICARE for Life, yeah, is for the retired military and their eligible family members. And they are required to have parts A and B, but it is credible for Part D. And TRICARE for Life is very comprehensive. Typically, no one will pick up a supplement in addition to that. And the CHAMP VA for Life, that's for if somebody were to pass away inactive in the military. Their family and beneficiaries would have this CHAMP VA, and that works through that one. I don't think I've ever been asked questions on that with Medicare. But I usually will just open this book and read through it with somebody if they have questions on it, because it varies from one thing to the other. With Indian Health Services, IHS, we have that a lot, in certain areas of our state. Members who are eligible for IHS, they would be, their Part B and D would not acquire penalties if they sign up late. But it is extremely cost savings for the tribes and IHS for individuals to have Medicare. So there's a big push for that, and some people do not, they want to exercise their treaty rights and just take the IHS benefits, but there's a big push because IHS is pretty severely underfunded, and they run out of funding every year about this time of the year, maybe a little bit later than this, but right around this time of the year they run out of money. And Medicare helps save a lot of IHS dollars, so if they can have Medicare pay for it rather than the tribe, use the tribe's budget, it saves the tribe a lot of money and leaves money for their family, younger people that would not have Medicare. There's a lot of other kind of insurance out there. You're gonna notice it's starting at page 173. I don't even hear of a lot of these, but let's say you have cancer insurance. It talks about that, that's part of that disease insurance. And it is very specific to the conditions of the diagnosis. And it talks about, how that works, within that. But typically, it is only paid, after Medicare, has it, and it certainly is not credible coverage for Medicare. It's not gonna avoid any penalties. Page 174, the health insurance marketplace, that's been, I mean, it's a lot of times known as Obamacare, but, you know, we follow under the federal marketplace, and the plans that are available in South Dakota. But that's for individuals to buy private insurance, and there are certain criteria that the plans have to cover, certain things. They have to have certain out-of-pocket maximums, they have to, very clearly communicate the coverage to the consumer and the cost, and then of course it could have tax, breaks to it too. It could have tax incentives to being enrolled. That is something that we do not deal with in the SHIINE program. We refer those to the navigators within South Dakota. But, you can help, if anybody asks, you could help them locate a navigator. That's here too. It's marketplace.cms.gov. And there's this local help, where it would list where they could go in your area for help. That is, and their open enrollment it's pretty
Yeah.
parallel to ours,
We
and
do
so that
get
can be confusing for our beneficiaries and theirs as well. Another quick thing on this other insurance, I wanted to point out page 179. We had a lot of questions on dental, vision, and hearing, and so I put in a section on each of those things, and some places people can go for help if they need dental, vision, or hearing coverage or help, assistance. So that's just listed if they need help. There are private insurance companies that sell that, if they wanted to go seek them out as well. There's a tab, I'm just gonna keep going, on Medicare fraud and abuse. And then in the back, there's, our resources, different organizations that we work with. I have the Department of Social Service offices, and other organizations that we may happen to work with listed in here. There's acronyms, there's a little dictionary, glossary type thing, and then there's also just different forms that we would use listed in here. And this is, I just printed last year's version. We update this before our refresher training in the fall. So there are changes that, numbers that will be updated as far as the limits for 2016 would be updated at that training. So, does anybody have any questions on this manual? It's really just a user, it's a guide just to have, if you have a question on the spot and you find this handy, if you wanna read up more on it, but it's a tool to help you answer questions if you're out in the field working, if you wanna use it.